Hello, my name is Kim Davis. I'm the chairperson of the Care and Nurture team here at North. Also joining me are Orson Mason and Pastor Diane. Our presentation today, Living in the COVID Era, is the first of a number of presentations that we will be offering regarding health and well-being. Eileen White is our presenter today. She is an epidemiologist and a nurse, and she'll be discussing living in the COVID era as it relates to the current pandemic and as to the upcoming flu season. Thank you. So Eileen, welcome, and thank you so much for coming.
Thanks so much for having me.
Oh, our pleasure. I guess I would like to just really tap into your expertise. If you would like to just sort of introduce us the basic background of COVID.
Sure.
And what's going on with it today.
Yeah.
Tell us that in 3 sentences.
Well, okay, quick summary. So I'm sure everybody knows, but in 2019, this novel virus was noted first in China, in Wuhan, China, when people started getting sick with respiratory symptoms mostly, is what was initially noted. And because our world is so built around travel and connection, we are all deeply interconnected. This virus spread just like most other viruses do. Flu is the same way. It's spread throughout the world. So now all of the countries that we work with and we do business in, we're all struggling in this same world of public health and trying to fight an epidemic that's become a global pandemic. So this disease, it started in China, but it has mutated a few times, which is totally normal for viruses. This happens. It has not changed the virus hugely. The mutations have been small, but just enough to make it more effective at transmitting and becoming more efficient in how it infects people. So where we are today is in a community that is we have widespread community transmission of COVID right now in our state, in pretty much every state in the United States. But it just varies in how each of the states have decided to handle it and what public health measures have been put in place to control the spread. That's your quick summary.
Yeah. Can you tell us a little bit more about what you mean by community spread versus other types of spread?
So if you think back to viruses that we deal with every day, you know that influenza has a season, and annually, there's different strains of influenza. And so, for example, in the Southern Hemisphere during their winter, which is our summer, they experience their flu season. And so we can talk a little bit more about that, but we look at other countries' seasonality in their disease to help us base our expectations for our seasonality in our disease. It's how we develop our flu vaccines. We look at the previous strains in other areas of the world. So when we talk about community transmission, we talk about the fact that people are out and about every day doing their daily things, going to the grocery store, going to work, going to school, and passing virus around. Without knowing it, you can be infected and asymptomatic with COVID. And so what is considered specifically community transmission is when we don't know where a person got their disease from. Okay. So if they're diagnosed,
they were sick and your daughter got it from you, most likely, or whatever.
Right. Yeah. And so if we have lots of folks out in the community not testing and are contact tracing, which is something we talk about later, but that's how we would alert people that person has been around to the fact that they've been close to somebody who was sick and they should quarantine themselves and go get tested. Those things help us get on top of community transmission. They help us stamp out an outbreak. It's what we do for all infectious disease. It's just that you don't know we're doing it for the most part in public health. So in this infectious disease, it's actually more widespread than most, and we are not able to get on top of the community transmission at this stage in our country.
Okay. Can you give us some information about people who are most at risk, who, why should we be concerned, who should be concerned, and symptoms we should watch for.
Sure. So everybody is at risk in our communities today. Small children all the way up to our elderly are at risk, but there are people who are more at risk of complications and having a severe course of this disease than others. So we know that folks who are older than 65, people who have conditions, we call them comorbid conditions, but that they live with something like, say, high blood pressure or diabetes. If they get COVID, oftentimes we're seeing that their disease and sort of their experience of COVID is complicated by already having high blood pressure or high blood sugar. And so we have to be careful that folks who know they have these diseases are taking precautions to try and keep themselves as safe as they can. So some of the conditions, so diabetes, high blood pressure, chronic kidney disease, folks with diseases of the lungs, so like asthma or COPD, folks who have struggled with sort of high weight, obese folks sometimes have poor courses of disease and need more intervention and help in a hospital than others. So there is a kind of a broad area of folks who are at risk. And I would also add those who have blood diseases. We are finding that COVID is, I'm sure people have heard, I'll tell you a little bit about the symptoms, but COVID starts for many folks with a shortness of breath. And what people will feel, and I can say this because I had it and it was very scary, was just a sudden onset of not being able to breathe. And if you feel like you're breathing maybe through a straw or something really smaller and tighter than your normal, you can't kind of get a full lung expansion. Some of the other symptoms, though, that folks are having that go along with this are problems with their vascular systems. So that's getting at those folks who have problems with bleeding or clotting. Those folks are also at high risk. We're finding that people who have COVID often have problems with either bleeding too much or clotting too much, sometimes strangely at the same time. And so folks in the hospital, we're seeing some of these weird coagulopathies are what they're called, along with the struggles to breathe and sometimes this brain fog they talk about, where it's kind of hard to focus on things. And so there's kind of a broad spectrum of symptoms that you might experience with this. But if you are feeling any of those symptoms, what you should do is try and isolate yourself in your house as much as you can and call your doctor right away. You want to make sure you're followed by your physician. If you have a primary care, or if you don't have a primary care, you have like an urgent care that you can do a telemedicine visit with. Oftentimes that's something that's offered in a lot of the health systems around Indianapolis these days. But you want to isolate yourself in your house away from your family members to try and contain this to just you, because it does spread quite easily. What we are finding is that it spreads both in droplet, meaning while I'm talking right now, pieces of spit or heavy respiratory droplets will come out. And that's kind of why we wear our cloth masks to try and keep that to ourselves, right? But there's another way it's transmitted, and that's called aerosol spread. And these are really tiny, really small viral particulates that come out when you speak or breathe or anything, really sing, especially sing, right? Or yell. So those are the things that tend to float in the air like smoke. So what we get concerned about with this kind of spread is that it doesn't just drop to the ground the way the droplet transmission does. It floats in the air. So we know that this is getting transmitted in a couple of different ways. So if you're living in a household, you want to try and keep both of those ways to yourself if possible. Your own bathroom, your own bedroom, and trying to stay as much away as you can from your family.
Are we finding it being transmitted through touch very much? Objects that we might, doorknobs or whatever.
That's a good question. I think in the beginning, I mean, we were all learning so much about this disease, and most of us, that was sort of the low-hanging fruit that we had control over.
Yeah.
So, the conversation from CDC, stuff that we've seen, in some of the studies that have come out, have shown that this virus can live in certain conditions on particular types of surfaces. So, we're talking about 24 hours on particular types of, aluminum or steel or countertops. And a lot of these things were done in labs, so not in real life situations. So what we've found over time from what we know about the spread of this virus is that the major mode of transmission is respiratory. So we know that people are getting it from respiratory transmission much more often than you would from touching things. Most surfaces in real life can't allow this to survive, right? So these are viruses that need particular conditions to live in. So that isn't to say that there is no risk. That is to say that if you are high risk yourself and you get your groceries and you don't know who's bringing them to you, and there's a lot of unknowns and you're unsure, you can go ahead and wipe those groceries down. It's not going to hurt you to do that. And it's also, in sort of a mental health way, good for some of us to feel like we have some control, right?
Yeah.
But it isn't the main way that this is transmitted. And you'll find that many recommendations coming out now from scientists at independent organizations. University of Minnesota has its Center for Infectious Disease. There is the Harvard folks, Johns Hopkins, those kinds of places where they're doing some of these studies. Are finding that that's not a major concern. But I will just say, having a mom who's immune compromised, that I ask her to continue to wipe down her groceries because she's had 2 cancers and finds herself at a significant risk.
Right. So, doesn't hurt anything.
Doesn't hurt at all. But just continue to stay aware of the main modes being respiratory. So you want to make sure that you're wearing your mask and that anybody you're around is wearing a mask and that you're staying socially distanced.
So, the thing I keep thinking about, because I work with younger people and, we talk about the people at most risk, what might you say to people who are, high school or particularly college age students who don't feel they're at risk and really are getting tired of being isolated and cooped up and feel like they just need to go places and things?
Yeah, this one's a tough one, right? It is normal developmentally for high schoolers and even for college, right? We know that the brain isn't fully developed until people are 25, right? Yeah. Around 25. So we say that's that frontal lobe that we talk about. That's impulse control, understanding consequences of your actions. That is not fully developed. So trying to expect folks to adhere to the same standards while in settings that put them in high risk of doing those activities. So if we send kids off to college campuses and we expect them to not get together, I think we're setting them up for a sort of a failure. But what I would say is, if you want to stay and continue doing your activities, everything you do has to be thinking about the fact that you can affect other people. So even if you don't feel like you yourself are at risk, you don't know that the person sitting next to you in class doesn't have some condition that you just can't see. So sometimes they don't in fact know that they have those conditions like diabetes or high blood pressure. Those happen in young folks too. We have to try and talk with folks that are in high school and college about balancing risk. And this is a big thing that in epidemiology we're focusing on, in public health we're focusing on. And so if they are finding themselves in places that they are close to others, like in a classroom, that they should not, in addition, be gathering in other areas and adding to the risk of transmitting this virus, because lots of people live with immune compromised family. And so there are small kids, there are old people that live in the same houses as some of these students. another big question is about kids, especially in college, living on campus and then going off campus for their, social activities. People who are off campus are often just the rest of the community, right? So if we were to have an outbreak on campus, the best possible situation is that we keep that on campus. As soon as kids go off campus and go back to the grocery store to grab something on their way back to their apartment, they breathe on somebody in the grocery store, and this is how an outbreak spreads quite quickly. Grocery store workers, all the people who are out in the community can be immune compromised, and it doesn't take much to get people very sick from this. Even if you're young and it doesn't affect you, it will affect other people.
Yeah. And we are seeing a lot of those people, such as grocery store, we're saying frontline workers, but those are, those people are at the highest risk. They're facing people every day with maybe not the same availability of PPE type of things.
Exactly. Yeah.
Yeah. So what about influenza?
Yeah.
What's going on with the flu season so far?
Yeah. So I will say there are a couple different schools of thought in public health now based on what we are seeing. So what we have seen in the Southern Hemisphere, right, we look to Australia, we look to places that have already come through their season to see how they did. They actually had very, very, very low rates of influenza in communities in the Southern Hemisphere. This can be for a couple reasons, right? So due to COVID, people are not traveling the way they were. People are not going between countries nearly as much. And some countries with high rates, like the US, can't go to other countries, right? Our passports are not being accepted in certain places. So we can think about disease, and we know how this spreads. And people get on airplanes and take it from country to country. It's how all disease spreads. So we can think about the fact that the influenza rate was pretty low in the Southern Hemisphere and say, okay, it could be cut because of that. It could also be, and these are not mutually exclusive, right, that we are wearing masks and staying distanced in ways that we have never done before as humanity, right? There are areas in this world, like in Asia, where they have been doing this for years, wearing masks, staying distanced, because they experienced epidemics that we did not. They went through SARS, they went through MERS. Those were other kinds of coronaviruses that were very, very lethal. They were even more lethal than COVID. But they were kept out of our country because we had solid public health initiatives and a global pandemic response that worked. So we haven't experienced it here. So what we're seeing is that in other countries where they're wearing masks and social distancing, the flu has not been very bad at all. That is not to say that we know for sure that's going to happen here. But what we can take away is we know that travel is not happening very much in the United States, let alone from other countries right now. We know that we're trying our best to mask and socially distance here, just as they are in other countries, though culturally it's a little more difficult here to get masks accepted and worn and for people to listen to the public health guidance to socially distance. So what we can say is that flu is very real. Flu can make you very, very sick. Flu is a respiratory disease, and we can have both of these diseases at the same time. So what we get concerned about is the idea that the flu will come, and we are already kind of at a space as a country where we are challenged to stay on top of healthcare for everybody, knowing that COVID is already here and making a lot of people sick. So we're trying to encourage everybody to get a flu shot this year, because in the very least, we need to be able to minimize one thing we can control, and that would be flu. Sorry, you can hear my dog snoring in the background. That would be the flu. And so getting the flu shot will give you a better chance of staying as healthy as you can this year. So they have ramped up production of flu shots in this country, and we're trying to get everybody a flu shot early this year because we don't know what's going to happen with COVID and what we're seeing.
How early are they recommending that people get that?
So for people who are generally at risk, right? I have asthma, my kids have asthma. The flu shots are already out. I had my kids vaccinated last week. So you can get them now. I think a lot of people think about getting the flu shot like it's the end of October, November. This year, we're trying to get everybody a flu shot as early as possible. We know they provide about 6 months of protection. So for most people, that's going to get you through the worst of the flu season. And so if you get your flu shot now, you will be well situated to have, in the very least, a minimal case of flu if you do get it. I mean, that is the hope of getting your flu vaccine, that if you do get the disease itself, you will have a milder course of the disease. And our hospitals will not be able to handle a big influx of both. So we have to do our best from a public health standpoint, get everybody protected as much as we can, as early as we can.
A lot of people are talking about a vaccine, a COVID vaccine. Yeah. And we hear a lot of conflicting information about that, a lot of hope. Do you even want to weigh in on that? I mean, maybe it's okay if you don't.
No, I think it's on us in public health to be clear about what we know and what we don't know. And that's the big struggle right now. Public health is dealing with so much politics, and the politics that is kind of influencing what is actually real, and what the real recommendations are, what the science is. So from a vaccine standpoint, right, there are lots of viruses that we don't have vaccines for. And I would like to just point out right from the start that there is never a given that we can get a vaccine for anything. So HIV doesn't have a vaccine. There is no way that we, through all these years, have come up with this yet, because it hasn't been possible with what we have. So it is fair to say for the science that we have right now shows us that we have effective options that they're taking through this process of vaccine approval. Again, with the understanding that nothing is guaranteed. Right? It does seem like there are a few different potential options for vaccines that have gone through the phases of vaccine development, and they have proven themselves to be, safe-ish. We're working on that last safe part, to be effective and to prevent the disease. But the problem that we have with vaccines is we in this country have not had a ton of people involved in the vaccine development. So what the hope is, as you take any drug through an approval process, is that you start with a few people, you see whether or not it has side effects and what the right dose is. Then you add on groups of people to see, how safe is this, and is it really as effective as we think? And then you have another phase where you're looking at whether or not this drug is more effective than any other drug, the standard of treatment for these people. But this is a vaccine, right? So it's a little different than how we approach drugs. And what we have to acknowledge here is that we are doing this vaccine development at light years faster than we ever have before. So there are concerns for safety, and those are valid concerns. What we hope to see before a vaccine is approved, it has to show that it's safe. So that's what this trial that's going on now, you'll hear this phase 3 clinical trial, is trying to figure out whether this is safe for everybody. There was recently, AstraZeneca had to pause their vaccine trial because there was a significant adverse event that was reported. That means somebody had something happen, and they needed to stop the trial to make sure that what happened wasn't due to the vaccine. So they did that. They made that determination based on their data and based on the progress of that person, and then they started the trial back up. So what we're going to see is a lot of this roller coaster ride of safety and pausing, and then safety checks. That's what we expect to happen. That's a good thing. Yeah. Before you ever take a vaccine, they have to release safety data. So you are guaranteed right now that the major institutions like Harvard and Johns Hopkins and University of Minnesota and Stanford and all these places are at the ready to review the safety information when it comes out. Yeah. So you as a normal layperson who doesn't understand all this technical stuff won't have to figure out all that safety data and information for yourselves. But I would encourage you to make sure that what you're reading and who you're getting your information from is an independent and trustworthy source, like an academic institution, not a government source right now, or even particularly, there are some think tanks that are kind of slanted. There's media. You don't really want to listen to that stuff. You want to get it from the experts who've spent their lives doing this work. So
yeah. It's gotten so challenging to, you know, we know that this has had to happen. Those of us who follow these things a little bit, like even the tiniest bit, know that these things are happening behind the scenes with every med that we take, with every vaccine that we take. And we're really glad, and that's the way it should be. But I think everybody's looking at this as though some sort of miracle is going to be pulled out of a hat. And, you know, it's just, I think we're all pining for whatever they feel is, we ever feel is normal. And I think that we're getting unwillingly, you know, a glimpse of what really can happen if we don't work together and don't do the right science-based interventions.
Yeah, and I will add, you know, we have hope that this vaccine will come, and that's a good thing to have. But you have to balance everything that you're hearing with the dose of reality that we don't have vaccines for every virus. So in addition to that, even if we get a vaccine, and even myself, you know, I'm sitting here going, oh, hey, it seems like we might 80%, maybe 80%, sure, we'll get a vaccine. That's great. It's not 100%. So even if we were to get this vaccine, and even if it were to come in January, and I will say that if there's something that's magically coming in October, I would highly question the safety of that. We are not at that point where in the trials right now where we would expect there to already be an approval in October for a vaccine. So if there is a January, say, approval of a vaccine, the country has ramped up the ability to kind of disseminate these vaccines, but we have 330 million people in this country, and we have to prioritize how we're giving these sorts of shots and to whom, and who this will be effective for. So elderly folks who get normal vaccines for things often need a sort of a higher dose in order to get their bodies to recognize things and develop immunity. So we need a few different types of vaccines, and we need a strategy to disseminate these to the high-risk folks first, healthcare workers and those who are most immune compromised. I don't expect us to be able to get everybody immunized in the spring. It will take months and months and months. So we have to think long-term. You know, part of this discussion will be mental health. We need to make sure we're sort of balancing our expectations and our hopes in a reality that this is another year for a lot of us. So I just want to make that clear, because I think that, as you said, it's hard to tell what real is right now.
Yeah, well, I can tell you, for people watching, this is September 22nd of 2020. So we're getting toward the end of September, and that's what we're talking about is, you know, what the expectations are for the next few months. And I'm a nurse also, and so I do see a lot of mental health issues. I wouldn't say people come in a lot and say, oh, I'm totally breaking down because of the pandemic has got me overwhelmed or anxious or uncertain. But we're seeing people who certainly have financial concerns that lead to increased mental health issues, that lead to increased substance use disorders. People with substance use disorders, if you have, you know, you're locked in your house, or you can't get on the bus to go to visit your family, or all sorts of, you know, the things that people stress about and are challenges in our everyday life, we see that magnified.
Yeah.
Diane, I'm sure you can speak to that too, just from people in the church, struggles that they're having would you like to add anything there?
Probably just that I think many of us are experiencing times of perhaps some depression, certainly some anxiety, simply because there is such an uncertainty. We don't have definite answers for a lot of what's happening, a lot of conflicting information out there. I feel that probably in recent months, have talked with people more, just experiencing an increased anxiety and depression types of symptoms. Sometimes talking with me can be enough, just because we often have folks who were isolated in many ways because of health and other factors before this pandemic. And now with the pandemic, there has been a further isolation. So sometimes they just need someone to be able to talk with.
Right.
But certainly I'm always on the outlook for those symptoms that pop up, and will be very quick to refer out. Anytime symptoms interfere with your daily living, that's certainly a time to seek outside care as well.
Yeah, for sure. Well, Eileen, do you have any broad topics or specific advice, things that you really just feel like we should all know about to best protect ourselves and our community, our family members and loved ones, and things that we should, be focusing on right now? Because as you said, we don't have a concrete end in sight. It's not like we're going to flip a light switch and the snow's going to melt and we're all going to go back to school like nothing ever happened.
Right. So, that one of the things that I think we as a nation, and especially maybe us in public health, need to do a better job about communicating out is this idea that there is a balance to be had in dealing with this, because it's long-term. And long-term doesn't mean 5 years, but it's not, like you said, a month or two, right? So we talk about this idea of risk mitigation and balance in life. And some folks have been deeply, deeply isolating and trying to stay absolutely, they're not going anywhere, and they haven't since March. And there are reasons why people might need to do that, depending on their own health risks. But there are other people who are just, they're trying their best to do the right thing for their communities. And so I think what I would hope is that we could communicate out that there are high risk activities and there are low risk activities, right? And then there's some places in the middle. So we know that any gatherings, if you're going to get together with folks, stay outside, right? And try and stay masked, even if you're outside, because we have different kinds of transmission that are happening. So keeping it outside is the best you can do. I myself haven't been inside a restaurant to sit down and eat. We've had some data showing us in different studies now, not just one, but multiple, that the ventilation systems are a place to be concerned about. So that doesn't mean that you don't go out to eat though, right? If you can find an outdoor patio that has well-spaced tables, and it's in a day where you feel like there's a little bit of, even just being outside, even if there's no wind, it's still going to be spreading your breathing everywhere, right? So you can expect there's dissipation in a normal outdoor environment in a different way than would happen in an indoor environment. So there are some things you can do to keep yourself feeling okay to get through this, right? For us, it's going out to dinner at an outdoor patio where there are fewer people and maybe at off hours with tables well spread out. There is a lot going on right now with folks concerned about schools. Schools are an increased risk. We have to be clear about that. That's an indoor ventilation system. Most of them can't, because of safety reasons, open their windows or doors. So a lot of these schools they're having kids at different amounts come in for the day. And so you have to balance that risk. If you send your kids to school, maybe you dial it back in other ways so that you're keeping a community in the forefront of your mind at all times, knowing that, yes, there's this increased exposure for my kids, but they need help and they need to be in school for their mental health, or maybe they get services in school. This is all a balance. So we need to do a good job of communicating that out to folks so that there's less. I think there's a stigma happening right now, where people are shaming others for certain activities, or feeling like the best way they can possibly function is just to stay holed up in their houses. I think we can all do better as communities at treating each other with kindness and understanding that everybody's situations are different, and that some people need to send their kids to school. But that means that sports and other activities that are close contact, that are lots of people in a room, we have to be very careful with. If you are high risk, I wouldn't expect that you would want to go into a basketball game that's indoors with maybe 100 people there. There are things that we need to keep in mind. So for our communities, we have widespread community transmission right now. I live in Hamilton County. I think your church is in Marion County. Mm-hmm. And there's still widespread community transmission. So the everyday sorts of decisions that we all have to make to go to the grocery store, wear your mask, socially distance, continue to do those things. Those are helping keep down spread that could be much worse right now if we weren't doing that. So I always tell people to remember what March and April looked like. We weren't masking, we weren't socially distancing, and we saw kind of a scary picture in our communities with spikes in cases and hospitalizations. So while I wish that we were doing a better job of everybody staying masked and staying away and not having parties and that kind of stuff, what we are doing that we know is working are masks and social distancing. So keep that up, and make sure you're considering your neighbors in your decisions.
I like that. So many of us think about ourselves first, which we have to do a certain amount of our own family, but there's so many people that are intertwined with, it's a domino effect that we have to really look at. Orson, I would invite you if you would like to jump in with any questions or comments.
I think particularly since we're speaking to the church community, to bring in the power of prayer, in addition to all of the science and all of the good information that's already been shared, as part of your coping mechanism and as part of our belief system, that prayer can have a positive effect as we work through this. I'm not suggesting prayer for the miraculous October vaccine, which cures all. I don't mean it in that sense. I mean it in the sense that positive thinking, believing that our own thoughts given to God and our faith help us to get through these times. And that's, I think we should bear that in mind as well. The other thing I would add is how you eat, what you eat, how you exercise, how you keep your mind active, all those things that we do routinely for good mental health need to be fortified and continued, because that's really going to help. Because if you stay too much listening to the radio and television, and it's all this, you change from one channel to the next and it's the same and the things are bad. Just bear in mind that they are on 24 hours a day and they have to fill that time. So it isn't that something new has happened. They just realize that not everybody's eyeball is on TV all the time. Yeah. So that means it's not meant for you 24 hours a day. Nothing new happened. So again, go back to your prayer, go back to your own methods that have been successful in the past about feeling good about yourself and those in your family and your circle, and exercise, eat well. Those things really are going to make a difference. So thank you.
Thank you, Orson. Does anybody, Eileen, anything else you'd like to add? Oh.
I think it's just, you know, from a public health perspective, I think we're all in this fight together. And I encourage everybody to reach out to your neighbors and your community. The fact that this is coming from a church is wonderful, because I think that there's a lot of misinformation and disinformation happening in the public right now. And so if what you learn from this is that there are independent places you can go for your information, and that sadly right now that isn't our government, just because we're seeing some politics and influencing some science. So if what you take away is that there are safe places, and those are usually something like Johns Hopkins or Harvard, and there's, you know, an organization called COVID Act Now as well that you can go on and look at, and share that information with your communities, and try and teach other people what's safe to consume from an information and science standpoint. That spreads just like your kindness and love and prayer spreads.
Thank you. We will be putting some resources up on the website, both regarding COVID, mental health resources, and of course we always have contact information for people at the church. So that will be available also along with this video. And I'm going to have Diane close us out. And thank you very much, Eileen, for your time. Thank you, Orson. And thank you, Diane. We've really enjoyed chatting with you and appreciate so much your expertise in this area.
Thank you.
And I'd like to say to everyone that we hope you found today's presentation both informative and helpful. Living in the COVID era is the first of a monthly series of presentations that we hope will promote good health and well-being in our North congregation as well as the community that surrounds us. Be sure to let us know on the Care and Nurture team what topics you would like to hear about in the future. We know this time of pandemic is challenging, filled with uncertainty. But in closing today, I would like to remind everyone that even within the most challenging of times, we are not alone. The one who creates us remains with us. And I'd like you to hear these words from Psalm 91. You who sit down in the high God's presence, spend the night in Shaddai's shadow, rescues you from hidden traps, shields you from deadly hazards. His huge outstretched arms protect you. Under them, you're perfectly safe. His arms fend off all harm. Amen.
Amen. Thank you very much, all.
Thank you.
Thank you.
Thank you.